give me shelter. Simple life, it's all we want to live. Give me food, give me clothes, give me love, and give me shelter. Yeah.
Welcome, ladies and gentlemen, to the We2R Liberians Movement Platform, your distinct and dynamic platform that speaks to and for the masses. We are not in the business of manufacturing players, pimps, and hustlers. Rather, we are in the business of changing and revolutionizing our thought process, not only in Liberia, but even around the world. Today, we're excited to have with us in studio, no other but our one and only Mr. Ansu Molley, who is the founder and visionary of the Molley Healthcare family practice.
Right west towards South
As
Avenue.
we all know, this family practice is right there in Seacan. You're going to get more information, but yes, welcome to the show, Ansu. Excited to have you. The podium is now yours.
Well, thanks a lot for having me, Ayiti. It's a pleasure. And I also want to thank all the viewers out there watching from here and around the world. It's a pleasure to sit here and actually be able to talk healthcare in reference to the Molley Family Healthcare practice. It's a pleasure, Charles. Thank you.
Well, because of time's sake, we're going to go right ahead into our program. We don't have enough time. We did promise our viewers that we were going to start somewhere around 8 p.m., but due to time factor and some other technical problem that we have had, now we are starting here a little before 9. It's pretty much 10:09. So we're going to try to get right into the program tonight. To begin with, Mr. Molley, could you first and foremost just share with our viewers here your personal background, and just tell us exactly what inspired you to start this practice?
Well, I'll be really try to be really quick here, but my initial background was in economics and finance. I have both an undergraduate and undergraduate degree in economics and finance. Did complete an internship at the Federal Reserve Bank in Philadelphia right after graduation in 2001, 2002. And eventually I will turn down my job at the Federal Reserve and pursued another finance position with BMW Financial Services in Dublin, Ohio. I also work with the Vineyard Leadership Institute and as a finance administrator, and the Commerce Bank, now TD Bank, as a loan administrator and officer here. Later on, I decided that finance wasn't my thing. I wasn't a really big fan of influencing interest rates. And as I discovered later on that most finance was a big deal. It was about money, banking, and financial markets. And I didn't want to be a part of I'm a big fan of free market systems. I like the market determine itself and find its own course. So with all those going on, I decided to pursue a completely different course. Traveled to Liberia and saw the healthcare crisis firsthand, and it really pushed me to change course. I decided to go into healthcare. Besides that, another thing that really pushed me was just my mom getting sick and watching my own kids. I wanted to control my time. I wanted to be able to treat my own mom. You know, watching immigrant population as I walked through hospitals around the United States, I realized that we weren't treated fairly, to be honest with you. And I saw that firsthand, like how the immigrants were treated when you walk into certain hospitals. I saw the disrespect firsthand. And it was then that I decided that maybe trying to run my own practice where I could actually care for my own mother that was being taken advantage of my own brothers and sisters would be something that will benefit a lot of people in the immigrant community. I also have a bachelor's and graduate degree in nursing administration, and I'm a board certified family nurse practitioner. I'm also pursuing a PhD in institutional leadership currently.
So that was power pack right there, Mr. Ansu. And again, we're excited to have you. Want to extend to you commendation for accepting our invitation. And we want to thank you for the job that you have started. And we believe that what you're doing is definitely going to serve our community. If not, it's already serving our community. You have quite a bit of, I would say, strong resume down there. And I mean, what we want to talk about here now as we proceed, our next question, what we want to ask here, what role did your immigrant background play in shaping your journey and the services your practice offered?
For me, healthcare, I believe, is a calling. I mean, turning down a position at the Federal Reserve Bank and having the discipline in finance and economics and just totally walking away from it, was something that I didn't expect. I had to make a decision. It was about call. It was about care and compassion for me. Just watching my brothers and sisters, watching the immigrant population in particular that were in need of healthcare services, and not actually being really cared for as they deserve to be is something that really pushed me. One person I look up to a lot is Albert Einstein. He once said that man is here for the sake of other men. He said many times a day I sit there and wondered how his own happiness had depended upon the labors of his fellow men and how much he should give back as much as he has received. You understand? It's something that pushed me a lot. Money's going to be made, a lot of money. But at the end of the day, what are you giving back? What does your name mean? Are you helping anybody else besides your own children? So those are questions I ask myself. I mean, and obviously I have no other way of being fully fulfilled without giving back to the immigrant community. I'll be specific, especially my fellow Liberians.
So I like your responses, and that will actually take me to our next question. And one of the reasons why, we want to, ask some of these questions is the fact that you left Liberia as a young man, as an immigrant, and we want to. The essence of the platform is actually to educate, to cultivate, and to empower. So we do see you here as a role model, as an example. So what were some of the challenges you as a young man, because it's been many years now. What were some of the challenges that, the toughest challenges you faced while pursuing your education and starting your practice?
Well, a lot of challenges, to be honest with you, but I'll keep it short. We have a lot of guys in Liberia, a lot of our fellow Liberians that understand exactly where I came from. I did graduate from St. Patrick's, and the war came, traveled to Liberia, hang around for a couple of years, like most of our youths out there, not doing a whole lot. And when I immigrated to America on a partial scholarship to study here in the United States, it was very tough. I still had to pay part of my tuition. With no means of doing that, I have to find work. It wasn't easy having a social security number that says not allowed to work without INS authorization. That's the first hurdle. So how do you figure out paying the rest of your tuition from your pocket, only being on a partial scholarship? At one point, I found myself basically working 4 jobs. I'll just write that. I worked in a college cafeteria. I washed dishes, basically. Worked at McDonald's. I was a McDonald's scholar with authorization from the INS to work there. I worked at a gas station at night. And I also, on weekends, I would just mow people's lawns around and make cash money, non-taxable, and that's how I survived paying my tuition, But also just basically watching how other students, other international students like myself, didn't have the privilege because not everyone was allowed to have work off campus. You have to actually apply. You have to understand the immigration laws to be able to do that. And I found it difficult that a lot of my colleagues from other countries like Kenya and other places did not have the means to do that. And I mean, it costs money to be able to finance all that and make it happen. So this is one of the difficulties I face while here. And another challenge was basically not just having to go to practice, being on a partial scholarship. I had to practice two times a day playing football, and then in addition to classes and working and just keeping my grades into perspective was a very difficult thing to do.
Wow, seems like you had a pretty difficult experience, and I know a lot of us who went through similar experiences can attest that yes, it is a rough and tough journey to leave Africa. Especially you was on scholarship, and there was some limitation placed on what you could do in terms of trying to find a job and things like that, and then trying to study at the same time to pursue your studies. But the next question I want to ask you here is, I know it may sound a little bit repetitive, but I have to ask you here, what was the moment or experience that made you decide to actually open the Molley Healthcare practice? What moment?
I would kind of like sort of quasi like a couple different moments. I think the one thing that really pushed me to go into healthcare and start my own practice was seeing my own mother being disrespected by a healthcare professional. And that was it for me. And I decided that, I have to do something. My rationale has changed over time. You walk away from those moments and you turn to forgive people. You try to change your mindset, the way you think. But from watching my mom being disrespected because she wasn't educated or could not speak English the way they wanted her to speak. And it was just something that turned me completely off and decided that, listen, I will one day start a practice, no matter how long it takes, to be able to help people like my mom, immigrant population from other countries, especially Liberia, that these population groups will be comfortable with their own provider, respecting them and dignifying them.
Thank you very much for the response. At some point, we'll pivot a little bit and we will be asking some other questions, because now we're talking about your personal life experience. I know, as you can see on anyone who has just tuned in, we had a flyer. On the flyer, we said general health talk, right? So we definitely going to be talking about that. But for right now, we want to kind of, just zooming on just Mr. Ansu, and just to get some background on him, his challenges, how he was able to get over and to start his practice. So that'll take me into our next question here. Can you tell us about the types of services the Molley Healthcare practice offers and how they benefit our community or your community?
Well, we are a primary care family practice, which means basically we are a doctor's office. Just like you will go out there and see your primary care provider, we offer the exact same services. We manage all patients across the lifespan, from a one-day-old baby up to like a 99 or 100-year-old individual. We're both certified with the ANCC, and I do have I'm credentialed with the American Health Association also. We manage diabetes, all medical conditions across the lifespan, like hypertension, hyperlipidemia, diabetes, osteoarthritis, and the list goes on. And one thing I'm really especially passionate about that we offer here is travel medicines, to be able to assist our immigrant population that travel frequently back and forth between other countries, Liberia, Sierra Leone, and other places. So we offer travel medicine. And the other thing that I'm especially passionate about when it comes to giving back, I am at, as far as services are concerned, we offer a preceptorship program to be able to train other healthcare professionals like nurses, nurse practitioners, and other PAs PAs are like physician assistants. So we offer this program here free of charge. We're a brand new practice, but we're looking forward to be able to assist our fellow Liberians and other immigrant population groups that are willing to like start their own businesses or pursue disciplines in healthcare as well.
So, Mr. Molley, thank you again for just giving all this. This is power pack. But I want to take you back to when you first launched your practice. I guess there was an opening, and there were, because I'm going to go back and forth, and there were a couple of people that you invited. We had some of our community leaders from the LAP to the Multicultural Center. I know there was one individual who I believe he was expiring for state representative or something along those lines. And they made a lot of promises. Can you talk to us? Just walk us through how because I know the practice has been around now for a little bit. What has been their contribution to actually bringing people like they promised? Because I did MC your program. Well, could you just walk us through some of the assistance that they've offered?
I'm going to be really frank here. I'm a big fan of giving back as much as I've received, like I indicated. But when we first launched our practice in August of last year, we did get support from some of my colleagues. But as far as promises that were made, in supporting this practice, we've been self-funded from the start. We've worked and provided all the equipment and resources that are in this practice. To be quite honest, it's a little disappointing. And for some reason, I don't feel like a lot of us Liberians support one another, which can be disappointing sometimes. But I say, when you change the way you look at things, the things you look at change. And when you change the things you look at, the way you look at things sometimes change. So you can't dwell upon who supports you or who did not support you. My take here is that I will continue to reach out to our immigrant population groups. When you do these things, it comes directly from it should come directly from your heart. You cannot dwell on who helped and who did not help. But to be really honest with you, we did not get any support from any of those people.
Okay, that's good. Good to know that. And now that'll take us to another question. For this question, how did you ensure that your practice would set, I would say, or cater to both Liberians, immigrant, and the U.S. citizens?
Well, my staff is primarily, I would say, immigrant population. Of the immigrant population, I do have a medical assistant that's a Liberian. I do have a receptionist that also a Liberian, and another's from Sierra Leone as well. And I do have my first nurse practitioner, actually, who was very, very helpful when I first reached out, is also a Liberian. So just bringing that group of people, immigrant population that basically understand the need of the population they are, the primary population group they're going to be serving is a big boost. You understand? So we're not just talking. No, we're walking the walk. We're bringing our own people in. And they are all professional people that will treat you with respect and dignity. And they are all very knowledgeable at their jobs. So I welcome everyone. This is somewhere you want to be.
So for the benefit of our viewers, if you've just tuned in, you're watching the We2R Liberians Movement platform. This is what we do, the platform that's in the business of changing mindset. We have with us in studio no other but Mr. Ansu Molley, who is a professional, a licensed nurse practitioner, who's here to talk to us, a general healthcare, health talk, whatever. But we want to kind of just get feedback about himself, and then we again pay it back to the services that he provides. So then our next question that we have here, because we put together some questions for you. can you tell us about the types of, we talked about that, types of services. So what has been the feedback from your patients regarding the services that you provide?
So far, the feedback has been generally positive. We are patient-centered in our focused practice. So we emphasize on respect and dignity. And every patient that walks out of here has given a positive feedback so far. So it's something that we look forward to continuing, and as more people begin to sign up to our practice.
Thank you for that response, and then we will go to our next question. We said, what impact do you think this transition will have on patient care? Right? That's in the transition I'm talking about. Let me ask the question before I get to that, because we did say that, I think when I got the call from you, that you have transition from paper to electronics. So now that would be EHR.
Yeah, electronic health records. Yeah.
Correct. So why did you decide, right, to transition from paper record to electronic health records?
Well, electronic health records has been around for a while, and is actually the standard of care. But when you first transition into running your own practice, the cost is enormous, very enormous cost associated with that. So EHR kind of like helps minimize that cost. It improves patient outcomes, and there's better collaboration between healthcare providers to enhance patient outcomes at the end of the day. Okay, and one thing I'm particularly excited about with the paper to our EHR transition is the fact that quality measures are really, really huge here. You're able to predict certain outcomes. You're able to strain. You're able to patients are able to basically control their own or manage some of their own health. They're actually part of the system of managing their own health. Okay, they have access to their records before an appointment. A patient can get on their phone or their tablet and just fill out forms and tell the provider. It's interactive as opposed to like other forms of charting. So EHR, is actually very safe as far as patient record. It ensures that HIPAA rules are applied and enforced. Patient records are very safe. But the huge thing is to be able to collaborate with other healthcare professionals and specialists around the country that have seen these patients. It actually helps enhance patient outcomes.
I think you just answered my next question, so I'm not even going to get into that, because that was exactly what I was going to ask. The impact do you think that the transition have on your patients? But I believe you already answered the question, because I think it has to do with the efficiency, how effective and efficient it is. So yep. you actually talked about that. So we will go to our next question. Our next question here is what changes or additions do you hope to make to your practice as it continue to grow and evolve? What are some of the changes you plan to make?
Well, one thing I'm definitely considering is hopefully not in the not too distant future is to have a radiology department. But that before that, we're hoping to move to our bigger space, our practice space. Our practice is relatively a good size, but we're hoping to move to a space where that can accommodate our own radiology department, where we don't have to be bothered with sending our patients to say a hospital to get an X-ray for maybe a broken arm or like some abdominal condition or no. So we're hoping to set up a whole radiology department sometime down the line, and then just add additional services in with that. So the radiology will be huge, and hopefully within the year, next 2 or 3, 4 years, we're hoping to move to a bigger space. But definitely the radiology department is something that I'm focused on.
So you're answering my next question. So I'll go back now. There have been a lot of health challenges in the community. Young men are falling. Some are dying from stroke, being impacted by major strokes and things of that nature. So your practice now is pretty much in proximity, where we have the Derby, we have Upper Derby, we have Aldine, we have. So what are the in terms of publicity? What means are you using to reach out to our people? And how do you intend to do that? Reach out to our people.
Well, we've been reaching out. Like, we started from a more traditional approach. We have like a lot of some immigrant, some of our own brothers and sisters are passing words out there, and we are starting to be hopefully within the next week or so we resume another aggressive marketing strategy. We'll have ads out there. We have flyers. We have some flyers out there. We're reaching out by word of mouth as well, and we're counting on our own brothers and sisters, patients out there to spread out the word that our practice is open and accepting new patients. But the primary thing we're about to do is just invest some money into advertising via Facebook and radio and whatever it takes.
Perfect. So when it comes to your patients' size, how many in terms of intake and things like that. I don't know if I'm using the right term now. I should say intake. But how many patients are you now seeing since you opened your practice?
Well, with the EHR, things are progressive. I'm going to be very progressive. We are hoping that at 4 speed, we should be able to see anywhere between 15 to 20 patients a day. Because we do have another nurse practitioner who's part-time, and I'm very proud of her. Her name is Josephine Lamine. She's one of my staff, and I was very honored that she accepted a position here. So with Josephine on board, we should be able to see anywhere between 15 to 20 patients a day. We do accept walk-ins. And I should backtrack here. Another thing I didn't add, we do a lot of physicals and PPDs, like school physicals, work physicals, DOT physicals, as physicals for truck drivers as well.
So thank you very much again, Mr. Molley, for all of those power-packed information. We want to extend to you commendation for your work. We really do appreciate it. We acknowledge you. Now, this will take us to the next question here. With all of these challenges that you have encountered, because you did mention from schooling to now migrating from just traditional or conventional to electronic or whatever, what do you call that? EHR, right?
Electronic health record.
Perfect. So what are some of the in addition to that, some of the changes, that you intend to do beyond that to enhance your practice so as to attract more customer or patient? I don't want to say customer, beyond your own Liberians or maybe Sierra Leonean, and what are you targeting? Whites? Are you targeting African Americans? Things like that.
Well, our patient population group is diverse. We do see, I actually have a lot of African American patients as well as Caucasian patients. And as I go out there more and more, most of those patients are patients that I've seen in the past. And once they learn that I have my own practice that I'm running here, most of them have been willing to come on board. But we're not just... I'd like to be honest about this piece. We're not just seeing just immigrant population groups, not just Liberians. Of course, I would love to treat Liberians because I'm not going to pretend those are my people, and that's it's a huge part of the reason why I began this initiative. But we have a diverse population group. But the main thing here is we treat everyone with respect and dignity.
So then I'll ask a question. I mean, maybe it will sound rhetorical. How important it is, what I mean, to you that your practice remain an inclusive and supportive space for immigrants community.
It's very important. I mean, it's at the core of everything I do. To be realistic, the immigrant population is right at the core. I've had situations where we support the immigrant population in several different ways. I have situations where a couple of people immigrated to the United States who did not have insurance and wanted to get jobs after they got here. And I actually had to drive almost 15, 20 miles to see these patients, and treat them and do their physicals for free. And I mean, we have initiatives that's focused on helping some of these population groups actually get their status is regularized as far as getting health insurance, public health insurance. And now we've been willing to do that in a few instances. And it's something that we are hoping to continue. So we're not just seeing people, patients that have health insurance. As time progresses and we have immigrant population groups that just arrived here, we're willing to see you until you're able to regularize your health insurance status. And that's something that we've been doing recently.
We want to thank you for your work. Also, we want to say, if you have just tuned in, this is the We2R Liberians Movement platform, the platform that's in the business of changing mindset. Just today, I went ahead. Yesterday, I did the same. Wanted to make sure I reached out to our own folks to let them know that we have one of our own, who has started his own practice. Who's no other. If you are watching, this is Mr. Ansu Molley, who went ahead. Not only did he cap a degree, but he went ahead, to start his own practice. And the essence of this practice is to actually give back to our people. Why it's true that, yes, he's working, but we encourage you to, swing by Mr. Ansu. Now, would you tell us exactly where your practice is located?
We're located in Seacan, is not far from Clifton Heights. 19018 is the zip code. The address is 649 South Avenue in Seacan, Pennsylvania. 19018 again. We do have a website, Molley Family Healthcare.net. We have a lot of information on there. You can book appointments as well. You can call the numbers on there. We do have one main number and another emergency number, 610-944-4290. It's our primary practice number. And for emergency purposes, after hours, we do have a 267-574-3288 number. We're open Mondays through Fridays by appointments mostly, but we do accept walk-ins as well.
Wow, it seems like a lot is going on for just starting. How long have you been in practice? Been in the business now? How long have you been practicing?
When we launched our practice since August 12th of last year, but we've been primarily seeing patients by appointments only. But now we have transitioned to the point where with the EHR, we are able to have walk-ins coming in. So since August 12th to now, but the preparation itself took longer than that, probably over 10 years.
So what are in terms of, because I know people come there to be treated, it's pretty expensive here to want to, pay out of pocket. What type of insurance are you accepting at your practice?
Well, we're currently credentialed with all the primary insurances around, starting with Medicare and Medicaid. We're credentialed with United Healthcare, Cigna, Humana, Blue Cross, Highmark, Independent. We're also credentialed with UPMC as well as recently Geisinger. So we see all patients. It doesn't matter which insurance you have, we will cover you. And if something that if it's an insurance payer that we're not credentialed with, I'm still willing to see you. And there's a timeline between which you can actually get credentialed with a payer. But if it's taking longer than that, I'm willing to forego the cost. But I'll still see anyone regardless of your insurance carrier.
So then this will bring me to another question. I know I hear, NP, nurse practitioner, is a family practice. What is your specialty in terms of seeing individuals? Because we have, if we're a family practice, are you able to see a wide range of patients from diabetes to whatever, or would you just walk us through?
Yes. So as a board certified family nurse practitioner, I do see patients across the lifespan. As I indicated earlier, it doesn't matter what the age is, from 1 day old until 150 years old. I'm credentialed and board certified to see those patients. Again, we manage every single medical condition from diabetes, hypertension, hyperlipidemia, gout, any kind of GI disorder, HIV, lupus. I mean, you name it. We are both certified and trained to manage those disorders. So it's open. We can manage anything. We can prescribe any. We can prescribe any medications that you need. Whether it's I don't prescribe. Honestly, personally, don't prescribe a lot of narcotics unless it's really needed. And I would like to emphasize that our practice does not engage in any kind of like services that breaks the rule of law. If you're a patient that needs narcotics and there's an indication for that, I will prescribe it. And I've actually turned back a few like of my own friends and family because it wasn't something that was indicated for the services that they came for. So I would not do that. But if it's within the rule of law, I will prescribe whatever is needed, and there's an indication. We do, with our lab, we are credentialed also with LabCorp and Quest, and with the EHR, I didn't mention that, but we have the Moment of Truth thing going where we have access to our labs firsthand. Our patients can either go to Quest or lab based on your insurance provider's request, or we can send you to whichever lab is your preference. We also have direct communication with any pharmacy in the country that you are willing. You don't have to be in Pennsylvania. If your pharmacy is in New Jersey or New York, we have direct link with those pharmacies to be able to like prescribe your medicines and have you pick them up from wherever electronically.
Awesome. That's awesome. Awesome. Again, we want to thank you for coming, and sharing with us time and space to talk about general health issues. We know the community is impacted by a whole variety of illness, and always say illnesses, from young to old. There's no limit. There has been a lot going on in our community. And so we don't want to sound redundant. We want to, because we're just about, we'll say a little over 35 or maybe 40 minutes into the program. And so I want to ask you, just before I get to maybe our last two questions, because again, we say the essence of the program is to cultivate young men. What word do you have for some young man or some young woman who's just coming to the country and wants to get into the nursing field? What would be your advice?
I would say spend some time, be patient, but yet spend a lot of time thinking about your career path. You don't want to start a career that you don't intend to pursue throughout down the line. Like, you have to choose a career. There's a difference between a career and a profession. One of my professors would say, a career is something that sustains you until you're able to like find that profession. A profession is something you love doing, basically. So I'll say, get a career, something that sustains you over time. Spend a lot of time thinking about where you want to go in life. Don't just choose a discipline just because it appears appealing. All my life, I wanted to be an investment banker. Graduate with undergraduate and graduate degrees, and had a lucrative internship at the Federal Reserve Bank. But I mean, where did I end up? I end up going back to healthcare because it's a calling for me. So it's not just a career, it's a profession. That's where I am. That's who I want to be. You understand? So I was advised way before I came to the US, but I did not listen to all that. I just wanted to pursue my own passion. So I would tell this young man, spend a lot of time thinking about your career choice. Just don't approach a discipline because it appears appealing or it's a white collar discipline. Spend that time, think about it, and decide on finding a career path that suits you.
Awesome. So then that'll take us to another question here. I think this question is very critical to the decisions that we make when it comes to our profession. So what advice would you give to other healthcare professionals or entrepreneurs, looking to start their own practices?
I'd say be patient. Be patient. No matter how difficult it is, no matter how hard it is, if you have the fortitude to keep going, keep going. But you also have to understand when to stop going. That's the difference. So basically, just make sure you you set definite goals. Don't blow your goals out to the point where they're so unrealistic. Have set definite goals. And once you have that burning desire to achieve it, no matter what comes in your way, it will happen for you. Walk away from anything or anyone that brings you bad vibes. Anything that stresses you out, stay away from it. Along that path, you hear a lot of things that, I don't think this can happen for you. You're not strong enough. You have to keep going. You have to believe in yourself no matter what. And I was just actually speaking with a young man a couple of weeks ago, about career paths. And I told him that, listen, you have to choose something that not just because you love doing it, it looks so nice and clean. No, you have to choose something that will sustain you while you find your way to where you want to be. So again, just be patient, have the fortitude to keep going, set definite goals, I would say, to those people, and it will happen for you.
Thank you very much for that response. So, Mr. Molley, I want to ask you one question before we close here. Was there ever a time that you got into nursing because of the money, or how lucrative you thought it was, or this was? I know you started a show mentioning that your mom was ill. There was a lot of other factors, but was there ever a time where you thought that I'll pivot to nursing because of the acquisition of wealth or the monetary compensation it comes with?
Definitely there was a time. But again, when you gravitate to a place where money is a non-factor, what else are you there for? You have to be able to reach back and give something. You can make all the money and it's not going to bring you happiness. For me personally, what really brings me happiness is giving back. And there were so many people that helped me get to this point. And I feel a strong responsibility to reach out to them and just give as much as I can, and something very interesting again is that you have to look at your life. What defines you? What makes you who you are? And this is going to be strong, but I'd say that at the end of our lives, or as we age over time, Mr. Williams, we're going to lose a lot. In 100 years, imagine from now, in 100 years, the babies that are born today, I believe, our whole generation is going to be wiped out. Our children, our friends, our family. So what are we here for? It's a deeper question. What's more fulfilling than just giving something or helping someone that needs help outside of your own children, outside of your own family? So I encourage all of us, all the viewers that are out here today, think about giving back. It doesn't have to be just your own family or your own friends, but give back to your community. Find ways to help people. We have to be self-fulfilling. We have to take care of ourselves. We have to pay our own bills. But the over-accumulation of wealth, personally, I think is dangerous. It's unnecessary. And we can sustain ourselves in other ways. We can have enough, but over-accumulating is very dangerous. Guys, let's help as much as we're able to.
Great. Thank you for that response. And so if you are watching and, to participate on the show tonight, if you had questions, I'm pretty sure that you're open to a few questions tonight you're ready to answer questions from anyone as it relates to this general health talk. So we will open the line now.
Charles, one more thing. Hopefully someone asked that, but I'd rather put this up. So, well, our vision, basically, what our vision here is for Molley Family Practice. We are hoping that within the next 5 years or so, between 5 to 10 years, we're hoping to open additional offices or branches or practices around the country. We're targeting specific states that have, a huge immigrant population. We're looking at Delaware, also Maryland, New Jersey, North Carolina, Minnesota, Ohio, North and South Dakota, and Rhode Island. So within the next 10 years, our goal is to be fully established in most of those states, especially the immigrant populated localities. Look out for that. It's coming. Hopefully within the next 1 to 2 years, we're hoping to be established in Delaware and Maryland, and we'll take that to New Jersey, North Carolina, Minnesota, Ohio, North and South Dakota, and Rhode Island.
Definitely, that would have been the next question after this, but you already answered that question. So we will now entertain questions. I guess you're open for questions since this is a general health talk. So if anyone, our followers, if you have any question, now I have on screen, my number. Mr. Molley has his number. There's a website that he has. I guess at the end of the show, he will also, he stated it before, then he can go ahead, state his number and how we can contact him. But if you have any question now, we'd like you to, if you feel like it, just call in and we can ask Mr. Molley a few questions here, and then we'll transition to try to close the show up here. So let's just give it a few minutes to see if we have people calling or an individual calling to ask you a few questions, and then we can wrap the show up. But in the meantime, what are you want to hear? You answer that already, because I'm pretty sure I had that particular question to ask you, but you already answered the question as to your 3 to 5 years plan, and I think it's something that's really important. But it's good that you started this and you're serving our community. We are happy to have you in the area. I've made the transition from PA, I'm out of state, but yes, anything we can do to help to promote this practice, to elevate because we had a show several weeks ago was titled The Complacency Factor or Crisis. Why is it that many Liberians are not self-driven? So this only is, you've now come up as an exception to the rules to be able to go ahead and start your own. Not only did you start your practice, or not only did you go and cap the degree, knowing that I mentioned on the show today that you came up through the bricks. I work with you, at Devereaux, where you came up and then you step up your game again, serve in supervisory role, where you were supervisor. That was something big. But to step up, to the game again and then start your own practice, it just speaks to the core that you're very resilient, you're strong, and it's ready to make it something of nothing. So we want to applaud you. And it seems like we don't have any call tonight. I will then ask you to give us your closing remark, and we'll go ahead and close the show.
I really appreciate
your closing remarks for tonight. But I also want you in this closing remark to say something, because we for sure we don't have a lot of viewers now. But people are gonna go back and watch the show. Some young men's out there, some young girls out there who sees you as a role model. What were there's a saying that says that confession is good for the soul. So I want you to come clean to tell us, because I know it wasn't easy. There was a lot of challenges there, but yet you were able to overcome those challenges. And now here you are, because many times we only see the success, but we don't know about the challenges. So what word do you have for some young men out there before we conclude the show here?
Well, the word here is don't give up. If you have a dream, go after it aggressively. If you get tired, take a break, but don't give up no matter what. Don't listen to those voices inside your head that say you can't do it. Because if you believe and set definite goals and have that burning desire to achieve them, you will. Do not give up. Find ways to be independent. Go hard at your dreams, and they will become a reality. Before I close here, I'd also like to say that we are a practice of inclusion. We love to help people. Our mission is to be able to serve with respect and dignity. We respect you regardless of where you come from, and we offer superior services relative to most of the other services that our people have received around. So if you put your trust in us to be your primary care provider, you're not going to regret it.
Again, thank you again for, coming to just give us your, words of encouragement to inform us on what you're doing in the area. You started a practice. We're excited about it. And, that brings me into a quote from Benjamin Elijah Mays, he said that one of the greatest tragedies in life is not failure, but the greatest tragedy is low aiming low. And as you can already see, from biblical text, Paul cautioned us to make every effort, not falling short, but to reach the mark. So anything is possible, like you said, Nami. If you believe it, you imagine it, definitely it will come to pass. And again, I want to close by using another, strong philosopher who is no other but, our own Dr. King. I always say is that, if you can't be a tree, be a bush. If you can be a highway, be a pathway, but be the best version of whatever you choose to be. So again, this is how we conclude this session of the show. You're watching the We2R Liberians Movement. Our title for today was From Paper to Progress, the journey of Molley Family Practice or Family Healthcare and its vision for the future. Thank you very much for tuning in. Again, we look forward to having you on the show. What we want to also do here is to have you come up maybe bi-weekly. That'll be something we can talk on the show. If not once a month or maybe once every 3 months, just come to talk to us about some general health talk. I think it'll be good for our community besides what you're doing. So hopefully you accept that. Until then, I look forward to talking to you. And have a great day. God bless.
My pleasure, Charles. Thank you.
Thank you.
Simple life is all we want to live. Give me food, give me clothes, give me love, and give me shelter.